My journey. After surviving 2 major car accidents that resulted in a severely broken arm, along with fractures in my back and pelvis, 2 natural childbirths, and numerous falls from horses, I thought I knew about pain. I considered myself pretty tough and resilient. I'd always recovered with the help of surgeries, medicines, and time. I think the best approach today is to share my story, is to describe a few of my experiences with chronic pain and our healthcare system. The beginning. About 13 years ago, chronic pain came whimpering into my life. I'd had many years of headaches, but I'd always been able to cope by taking aspirin or Tylenol. But then I realized my pain wasn't responding to them. My doctor sent me off to physical therapy, resulting in some temporary relief. Other pain complaints soon appeared. I got heel pain, neck pain, face pain, shoulder pain, arm pain, and those continuing headaches didn't respond to OTCs anymore. I didn't know it then, but I had entered the very confusing world of fibromyalgia and chronic pain. Sleep eluded me along with fatigue and muscle pain. I kept thinking that I must be getting the flu over and over. My doctor had few answers. Then one visit, I saw his partner who said, "You've got fibromyalgia." I was then started on a vast collection of different drugs. To this day, my drug list is well over 35 medications. Some of them helped, some of them had intolerable side effects, and some had little or no benefit. What I did to help myself. I read books about fibromyalgia, learned all I could to help myself. I read about the team approach comprised of a doctor, a physical therapist of some kind, and the patient themselves to work out a plan of attack. I had no idea how to create this team approach, but it sounded effective. The more I read, the more I didn't want this mysterious collection of symptoms, especially when I realized that fibromyalgia had no cure. But since we can't choose our diseases, I was stuck. I started following suggestions about physical therapies from my books. I searched for therapists who practice in the Sacramento area where I live. The first therapy was lymphatic drainage, then came myofascial release. Then I had neuromuscular massage, deep breathing exercises, trigger point work, heated pool exercises, stretching exercises, positive imagery and visualization, ball therapy exercises, Swedish massage, cranial sacral release, Bowen therapy, acupressure, spray and stretch, chiropractic, acupuncture, adaptive yoga, and a short lesson in Tai Chi. I currently have sessions in massage and trigger point therapy twice a week. Almost all of these have provided some degree of temporary relief. I still do stretching and ball exercises almost daily. I've seen at least a dozen specialists, have had many MRIs, X-rays, and CT scans to learn that I have severe facet disease, degenerative disc disease, severe arthritis, and cervical stenosis. I have plenty of reasons to hurt. I know that doctors have done their best to diagnose my problems. Now I want them to do their best to help the pain. I've had about a dozen epidural steroid injections in my neck and lumbar area. These provided some relief, but like physical therapies, there is little long-term relief from them. At first, I thought there was a magic pill that would fix my pain. After all these years, I now understand that medicine alone will not fix me. It's like the car tire analogy that I took from one of Penny's articles, that we have 4 tires, each one filled with something different, which eventually enables the car to run smoothly. Pain medications fill one of my tires. My other 3 tires are filled by support systems, including my husband, my family, the ACPA, body work, and just personal strength. I only expect pain relief help from doctors to fill 1 tire. I don't expect drugs to eliminate 100% of my pain. A low level of pain will do. On the all too familiar scale of what is your pain level from 1 to 10, I'm always a 3 or a 4. That's normal for me on a good day. To me, this should be simple. I hurt, I go to the doctor, and he or she does what he or she has been trained to do, alleviate my pain and suffering. This is not what has always happened. Instead of help, I have too often faced comments like, "I hate to see you strung out on morphine," and you don't want the label of fibromyalgia, do you? I've been told to learn to live with it or go elsewhere for stronger drugs or take up new hobbies. The thoughtless comments from the medical professionals have hurt deeply. I try to see my situation from their side, but my pain overrides the ways of reason. The pain can be so difficult that I prayed I would not see the morning light. I would curse God that I would have lived yet through another night. Who wants to continue in a maze of unremitting pain? What point is there to life when I know there's help out there, but I can't have it? What sense does this make? I used to stand in the lobby of the medical building in Sacramento, and I would see all of the different specialties and what floor they're on. And I would wonder, why can't I see somebody? Why isn't there somebody in all of the specialties that can't help? And there rarely was. At times I thought I was going crazy. If doctors didn't believe how much pain I was I just imagining my pain level? I wonder why my arms would hurt so when there'd never been an injury to that area. There have been times when I couldn't use my arms to pull up covers. I would get into bed with a small blanket around my shoulders to help keep me warm. My arm pain eventually went away to be placed by tooth pain so severe that I almost had a root canal. This pain then traveled to my leg where I spent 5 days on crutches. So each day is a new experience with the question, what is the pain du jour? I don't care about the problems that doctors face. I care about us. I wonder how many doctors would go meekly into the night if they had suffered like so many of us do. I'd always thought that doctors were there to help people until I got chronic pain. I have learned that acute pain protects life. Chronic pain can destroy it. I've also learned that knowledge and the skill level of doctors regarding chronic pain varies immensely. I learned this the hard way. 5 years ago, I talked to my primary care about using the fentanyl patch. The Vicodin didn't really keep my pain under any kind of control, and I was desperate for more pain relief. After a few months of different strengths, I was put on the 75 mcg patch. I read that fentanyl was a very strong pain medication, but after 6 months or so, I realized that my pain was actually as bad as it had been before the patch. When I asked my PC about stopping the fentanyl, he told me to cut the patches into halves and then into quarters. This is honest to God, he did, using tape to secure them to my arm. Well, the package instructions never said to cut the patches, and I had read enough on the internet to know that shouldn't be done. I didn't take his advice, but continued using the patch since I was too scared to stop it suddenly. I was at the pain clinic about my husband when I mentioned my concerns about the fentanyl patch to the pain doctor. Well, she told me to never cut the patch, and that I would need a very gradual reduction in stopping the patch along with close monitoring. Meanwhile, the side effects from the patch were increasing. I finally asked my PC about stopping fentanyl, but I didn't want to cut the patches, so he then prescribed 4 patches in declining strengths. I followed his instructions to the letter. By the end of 2 weeks, I was so very sick from withdrawal. It was a nightmarish experience, to say the least. He gave me no drugs to cover the pain when the fentanyl was stopped. I had to tough this out for 5 weeks until I got to the pain clinic, where I was started on different pain drugs, one an opiate. I have since changed my primary care. My struggle for getting stronger pain medication has been difficult. 5 weeks after the fentanyl patch episode, I returned to my pain clinic, where I endured the humiliation of being drug tested for the first time. Me, drug tested. How dare the medical system question my drug use? I grew up in the 60s, but was hardly a child in the 60s. I followed the rules, and to this day have never smoked, used alcohol, or illegal drugs. I resent being treated like a potential drug addict. My only crime is that I have chronic pain. Another example is the way the triplicate prescriptions are handled. This can be very difficult when we're sick with pain or don't have transportation or somebody to run the prescription back and forth from doctor to pharmacy. Why does the government continue punishing people for having severe chronic pain? Where is the humanity? The financial cost of chronic pain has been high for us. I figured we spent well over $75,000 over these past 13 years. I spent on average of $700 a month for 6 physical therapy sessions co-pays and drugs that are not covered. And without insurance, I wonder how people without insurance manage. I now have a primary care who is carefully venturing into stronger doses of medicine for me. And by the way, I have signed no contract. I completely forgot, but I don't remember doing that. I still feel like I'm undertreated for pain, but I realize I must play by the rules. Being able to have a trusting relationship with my doctor is my goal. I am developing one, I hope, with my new PC. So at last, I'll have a doctor on my side. On one visit, I was going on about how carefully I followed the medication directions. I really wanted him to understand how much pain I was dealing with and how careful I was when he interrupted and said, "I believe you about your pain level." That meant a great deal. I have been so disappointed by so many doctors. Over these past dozen or so years, I would anticipate a new doctor visit with such hope. Maybe this doctor can help. I would research and prepare carefully worded questions, but all too often the visit would be yet another failure. Another waste of my time, as well as my hopes being crushed. Remember when I talked about wanting a team approach to pain management? Well, it took cancer for me to experience this. The first and only time I've had a team approach to managing my pain was this July when I was in the middle of chemotherapy after surgery for grade 3 intermediate cancer. I had told my oncologist that the chemo drugs intensified my pain many times over for a week after the chemo. He said it would get better to tough it out. The pain hit my legs and joint and feet especially bad, causing muscle weakness, necessitating me to use a walker for the week. Sleep was difficult because my leg pain was so intense. When it came time for the third chemotherapy, I told my story to my nurse. After hearing my previous experiences, she said she would contact my oncologist to work out a way to help with the pain. She not only talked to him twice that day, she called the oncology pharmacist to get her advice. A plan was worked out. I was to increase my pain medications as well as their frequency. I took the plan to my PC, who wrote out the necessary prescriptions and refills. That day I had a team of 4 people trying to help my pain. The ultimate plan helped a great deal, and all this happened because of a nurse who did what she was trained to do, as well as using her basic humanity. She listened and believed. I will always be indebted to her. The validation by this nurse and my primary care doctor mean a great deal to me. I've learned the value of support systems. My 2 support systems are my husband, Larry, and the ACPA. My husband has learned how to do basic massage and myofascial release. We have a massage table, so on an almost nightly basis we head off to the therapy room for an hour or so of massage. Without his help, my life would be a hell. He has never questioned or doubted my pain, never. He's always there for doctor's visits. He's been up with me in the middle of the night, massaging my neck, legs, or hips for me to get some pain relief. My other support system is the ACPA. 6 years ago, I joined the Sacramento Chronic Pain Support Group. For the past 2 years, I've been facilitating the meetings. As we know, the more you teach, the more you learn. I began to see the value of the group. The knowledge I've learned from the ACPA has been invaluable for me. I now consider myself a person, albeit a person with chronic pain, but not a person defined by pain. I just happen to have it. I find it so interesting that when new members attend their first meeting, they tell the group about themselves. Almost every story is the same. We only have to change the names, the dates, the disease or injury to tell the story of every other person with chronic pain. I think it's a very sad observation that almost every person has had significant trouble getting pain relief from their doctors. It is a rare person who has a trusting relationship with their doctor and enough pain medication to give just basic pain relief to lead a normal life. I think this is a very sad commentary on the state of pain management in California. I do hope that this forum will be an insight into the lives of chronic pain people from this workshop, thus helping thousands of us in chronic pain. Please remember that acute pain protects life. Chronic pain can destroy.